Like one day I woke up and these things were on my face. I can't really describe the pain to you. I was constantly conscious of whether or not somebody was looking at the keloid as opposed to looking at me. My whole thought pattern was, are people looking at these keloids? And it caused me to not really even want to associate, you know, and speak to people. I mean, I really was self-conscious about them. There were people who were actually bold enough to ask, you know, what are those things on your face? You know, how did you get those things on your face? What happened, you know, to your face? And that just magnified, you know, the issue for me that these keloids were definitely a problem. There is hope beyond keloids. No longer do you have to be trapped in your own skin. There is a solution.
So keloid is not a cancer, but it is a tumor. It's a benign growth. It is not something that can spread like a cancer or a malignancy. But it is a tumor in the sense that it's an abnormal growth, and it grows somewhat out of control. Having an acne blemish, having a tattoo, having an animal scratch you. Literally anything that damages the skin can cause a keloid formation, even a simple vaccination.
To realize that I had these keloids on my face, it would probably bring you to tears, because many nights it brought me to tears. I was very self-conscious in thinking that individuals were looking at the keloids as opposed to looking, you know, at me. During moot court competitions and I'm standing up there arguing, you know, on behalf of individuals, you know, I'm constantly conscious of whether or not these people are looking at these growths that were on my face and really not hearing what I had to say.
So it's very important to give people the opportunity to know that there is a treatment protocol out there that is effective, that works well, and that's relatively simple.
I was stringing through this magazine and I see a picture of this young man who grew up in my church. And his story was about his keloid and how he had had it removed and went through this innovative procedure, and the results were outstanding. And when I read the story, I knew that I had to do the same thing. This was the cure for the plague that really had, you know, haunted me for so many years.
What we have identified and found over the years is that there have been a number of different treatments that have been done after a patient has had the keloid resected. In the past, some of these treatments have not met with very good success in terms of having the keloid reoccur. What we know is that by the addition of radiation, we are seeing a marked reduction in the number of times that the keloid will reoccur. In some instances, the recurrence rate is less than 5%. We've been very fortunate here at the Botsford Cancer Center that over the past few years, we've been using a new dose rate application that we came up with Dr. Hajar. And since that time, we have not had a single patient have the keloid recur after it's been surgically resected.
It's very nice to work in an environment where the cancer center and the surgical operating room is so close to one another. So it's very safe for the patient and it's very convenient for the patient to undergo surgery and then immediately be transported over to the cancer center for the radiation treatment.
When I woke up, it was over. Immediately after that, I came to the Botsford Cancer Center and started my radiation treatment. That continued for 5 days. And after that, it was over. It was simple, and I was able to move on with my life rather quickly.
When you combine a plastic surgeon excising the keloid and an expert radiation oncologist treating the keloid scar immediately following the procedure of excision, that your results are fantastic and your recurrence rates are low.
They're so happy about getting back into a normal life that it's really very much a joy to see them come back and see how happy they are.
When I realized I could go through this procedure and actually have these keloids removed, it was like Christmas for me. It was the anticipation of receiving what you always wanted for Christmas, and it was Christmas for me. When I look in the mirror every day, it's funny because I call my children and my wife into the bathroom and I say, look how good I look. And they're happy for me, I'm happy for me, and I just couldn't be happier with the results of the procedure. This totally changed my life. I can't express to you really what going through this procedure has meant for me, meant for my family. My wife, she knew how self-conscious I was about it, but she loved me anyway, and I'm grateful for it. But now, without the keloids, I feel more like the Prince Charming she married.